Our project looked at complex syntax use in children who are deaf and hard of hearing. The purpose of our study was to quantify the amount and types of complex syntax used by children who are deaf and hard of hearing. Complex syntax utterances contain one or more dependent clauses, enable children to convey necessary information for a variety of purposes, and they emerge soon after the two-word utterances. Despite its importance, little is known about complex syntax development in children who are deaf and hard of hearing. And I was interested in this topic because the development of complex syntax in children is important for their future in academics and social settings, and is often overlooked during intervention. 14 children who are deaf and hard of hearing between the ages of 2 to 5 years, who are enrolled in the Kansas State School for the Deaf's Language Assessment Program, are included in these preliminary analyses. We collected language samples in play, narrative, and conversation contexts encoded for complex syntax. We found that the 4 and 5-year-olds had more instances of complex syntax use than the younger age groups, and as expected, the most common types of complex syntax at the youngest age were reduced infinitives and let's clauses. An example of a reduced infinitive is I don't want to throw, and an example of a let's clause is let's read it again. Reduced infinitives, simple infinitives, coordinate clauses, and full prepositional clauses were most common at older ages. An example of a simple infinitive is I want to sleep. An example of a coordinate clause is I don't like to shout or to scream. And a full prepositional clause is I think we can do it. Higher level types of complex syntax were rarely observed. An example of a relative clause is it's just a nice note and stuff that connect this to you. And a nominal relative clause is, and then that's when they were younger. The pie charts reflect these findings. Participants in the younger age groups, around 2 years, produced precursors to complex syntax, which are those reduced infinitives in the let's clauses. These types of utterances are observed to emerge at the age 2 to 3 in children with typical language. Older participants used the complex syntax primarily included early developing forms of complex syntax, which are those simple infinitives and the coordinate clauses. This early stage study demonstrates the feasibility of coding complex syntax of preschool children who are deaf and hard of hearing from language samples. For future studies, we would suggest looking at longitudinal analyses of growth and amount and diversity of complex syntax with a larger sample to overcome current and limitations related to sample size and sampling error. And we'd also like to examine the complex syntax used in children who use American Sign Language. We appreciate the collaboration with the Kansas State School for the Deaf and the Language Assessment Program for making this project possible. Thank you.